Have you ever wondered how doctors can see what's happening inside your body without making a single cut? Well, that's the fascinating world of radiography. And today I'm going to break it down for you in the simplest, most interesting way possible. Alright. So, radiography is actually both an art and a science. Yeah, it's the use of medical imaging to see inside the human body, beyond the skin, and also beyond what the eyes can see. So think of it as special cameras that capture pictures of bones, organs, and even how certain body systems work in real time. All right, so let's talk about the most common and oldest imaging technique first, which is the conventional X-ray imaging. This particular one is painless. In fact, it's all painless, quick, and still one of the most powerful tools in medicine. All right, take this hand X-ray for example. Here, X-ray passes through the hand, but the bones kind of block them more than the soft tissues. That's why bones look white, while the muscles and skin appear with different shades of gray. Doctors use this to check for fractures, dislocation, arthritis, and even certain infections. Okay, now here's a knee X-ray. This one helps doctors to see fractures, joint spaces, or wear and tear from arthritis. And sometimes we take the image while you're standing, like this particular one you're looking at, so the doctor can actually see how your body weight is affecting the joints. Then here's a chest X-ray. The chest X-ray is probably the most common type of X-ray you've seen. It's actually fast and it provides so much information at once. Doctors use it to check for pneumonia, tuberculosis, lung tumors, heart size, or even fluid around the lungs. Okay, so it's often the first test when someone comes to the hospital with cough, chest pain, or shortness of breath. Yeah, so conventional X-ray, as you can see, is actually really versatile, from tiny bones in your hand to even bigger structures like the chest and spine. It provides doctors with a clear map of what's actually happening inside your body without even a single cut. Well, radiography is not just about X-rays. Okay, there's a whole family of imaging techniques that define radiography. So let's dive into some of them briefly. First, let's talk about, or rather, secondly, let's talk about the CT scan, which is the computed tomography. You can think of CT as an advanced X-ray machine that takes multiple pictures from different angles, and then a computer then stacks these slices together to form a highly detailed 3D image. Yeah, it's especially useful for detecting internal bleeding, brain injuries, tumors, and even detailed images of the lungs or abdomen. Okay, just imagine slicing bread and looking at each piece, then putting them back together to see the full loaf. Yeah, that's CT in action. All right, so let's take a look at MRI, the magnetic resonance imaging. This one is kind of different from CT because it doesn't use ionizing radiation at all. So instead of using ionizing radiation, it uses strong magnets and radio waves to produce extremely detailed images, especially of the brain, the spine, the muscles, and soft tissues. Okay, so it's perfect for spotting things like slip discs, brain tumors, or muscle tears. So if a CT is great for looking at structure, MRI is like a magnifying lens, a magnifying glass for the body's soft tissue. Another imaging modality that would interest you is ultrasound. Yeah, ultrasound works with sound waves similar to how bats use echoes to navigate. So these sound waves bounce back from, it's bounced back to form moving images on the screen in a way. It's most famous for showing babies in the womb, but it's also widely used for other body parts and organs. Okay, so let's clear up this one big myth right now. Ultrasound is not just for pregnant women. All right, so see this guy here. Yeah, definitely is not pregnant, unless we're about to maybe announce the world's first dad to be belly scan. So the sonographer is just checking his abdominal organs, which includes his liver, kidneys, pancreas, bowels, and several other intra-abdominal structures. Okay, and then this little champ you see here, nope, she's not carrying twins either. So here the sonographer is just scanning the neck to make sure everything looks fine inside. So next time someone says ultrasound is only for pregnant women, you can tell them nope. Men, women, kids, basically anyone with a body can get scanned. Alright. So ultrasound scan is safe, it's painless, radiation free, and shows real-time pictures like a live TV broadcast of what's happening inside you. Okay, so another modality we have is the fluoroscopy machine here. Now just imagine an x-ray that doesn't just take snapshots, but it shows a live video. Yeah, that's fluoroscopy. It's used when doctors need to watch movements inside the body, like swallowing, blood flow through vessels, or guiding catheters through during surgery. Okay, so it's almost like having a movie camera inside you, guiding doctors step by step. Okay, and here we have the mammography machine. Mammography is like a special type of x-ray that is designed for the breast. It uses low dose radiation to detect early signs of breast cancer, sometimes even before a lump can be felt. Mammography saves countless lives by catching problems early when treatment is most effective. Okay, so just see it as x-ray of the breast. All right. What makes radiography amazing is its role in solving medical mysteries. Yeah, it helps doctors see clearly whether it's a broken bone, pneumonia, kidney stones, heart disease, or even hidden tumors. All right, so without it, diagnosis would be like guessing in the dark. Okay, so just imagine yourself, like imagine you're a mechanic, but instead of fixing cars, you're fixing humans. Wouldn't it be hard to repair an engine without opening the hood? So radiography is like that flashlight that lets the doctors to peek under the hood without cutting you open. Okay, so you can say that radiography is truly the eye of modern medicine, guiding doctors to make the right decisions quickly and accurately. Okay, and guess what? This is just the beginning. Yeah, beyond these modalities, there are even more advanced diagnostic imaging techniques like PETs, SPECT, and even hybrid imaging like the PET-CT and the PET-MRI, which combine different technologies to give even more precise answers. Okay, so now tell me, if you could maybe pick one imaging test for me to explain in detail, which would you choose first? Drop your choice in the comments and let's make learning radiography fun together. Thank you.